Hi everyone. Um, I don't know who's going to see this video, but some of you guys might know me and others maybe not. My name is Natasha and I am a nursing student here at McEwen. Um, and my background is as a therapy assistant, majoring in speech and language. So today I just kind of wanted to talk to you guys a little bit about communication barriers that you might see in the hospital and what different kind of tips and tricks that you can do to help alleviate some miscommunication going on or trying to get your patients to understand what you're talking about. So I've attached a PDF with some different tools you can use, as well as I have attached the PowerPoint slide that I am using right now. So you can follow along using that and write notes if you want to. You don't have to, of course. But yeah, so I hope you enjoy and let's just get started. Let's see if I can figure this out. Okay, so here we go. Speech, language, and communication. Okay, so here we will cover just a basic overview of what speech and language is, and then we will go and look at some common diagnoses you might see in the hospital. And lastly, we'll look at some speech and language tips and skills. So here we go. Some little humor for you guys. A little bit of Ryan Gosling. Anyway, so what is the difference between speech and language? This is a question I get a lot, as a lot of people don't know that there is a difference between speech and language. So, first off, let's look at speech. So this is the most recognized thing that people think of when they think of speech and language. And they think of an SLP, they think, okay, someone can't talk, we're going to teach them how to talk. They can't make a sound, we're going to teach them how to make a sound. And that's correct. But when it comes to making sounds, that actually falls under the umbrella of speech. So again, what speech is the working on making of sounds. So up in the top right corner, I have how we progress as speech and language assistants and pathologists in helping people learn how to make different sounds and words. So there's a little bit of a hierarchy that goes on up there. Um, so something that really helps people with making different sounds is just making sure they speak slowly, and making sure that we have support for them. Usually this is done by, again, like an SLP or an SLPA. So yeah, as an assistant, I've worked with kids making different sounds, and just like anything you see, like we start with maximal support. So we might move their mouth, do like physical touching, physical support that way. And eventually we move to like verbal cues and just until they get to the stage where they can produce a sound on their own. So that's a little bit of a brief overview on what speech is. Now let's take a look at language. So language is a little bit more complex. Um, when it comes to language, there's so much we can teach. Um, it's quite amazing. Um, some basic things that are part of language is recognizing social cues. Storytelling and sequencing is another part of language. Knowing what is appropriate behavior based on the environment, that's another part of language. Even things like turn taking when talking, executive functioning, so making sure that frontal cortex is working properly and we're able to sit there and map out what's going on, and figuring out what's a priority, what's not a priority, what we're going to do today. So that's part of language as well. And just most generally, especially with young kiddos, it's encouraging social interaction. Now, one thing I want to say is nonverbal communication is huge. It's 70% of communication is nonverbal, and a lot of people don't realize this, but it's so true. And you might have heard it in some of your other communication classes in nursing, but as a speech and language perspective, it is so big, so big. So we take a look at this next slide, kind of going on that nonverbal communication part, uh, sometimes you can't see a language disorder. So this right here is my wonderful fiance. I don't know if he knows I'm using his picture right now. It's come across a couple times in thought conversation, but well, I hope he's okay with it still. So when you look at this picture, you just see a normal guy. I mean, he's not super normal. He's kind of posing, but but you wouldn't think much of him. You wouldn't think much looking at him like, oh, he's not so different. So you wouldn't probably treat him very differently. When in fact, he actually has a language disability. My fiance has severe attention deficit disorder, and he also can't read people's nonverbal signs. So this means that when I'm talking and I'm moving my hands, he doesn't know what I'm doing. He doesn't get that I'm moving my hands. When he looks at my face, he doesn't know what my face is doing. He doesn't know if I'm happy. He doesn't know if I'm sad. Just any basic body postures you make, you're leaning back on something, you're trying to be cool or something, like he doesn't get it. It totally goes over him, and he doesn't process it the same way as most of us are able to. So with that, I know for us in our lives, verbal communication has become a big part of our lives. However, for him, luckily enough, he's been able to kind of learn to read our faces over the years, and he's able to kind of pick up on different nonverbal expressions in our faces, like my eyes. He can kind of read my eyes, and he kind of knows how to read my facial expressions a little bit better now, but it still has great difficulty. So that being said, you might meet some people in the hospital where you don't think that they have any kind of problem, and when in fact they do. So just something kind of to keep in the back of your mind. So, what kind of disorders might you see in the hospital? Well, there's so many disorders out there. We're just going to kind of look at a couple of them right now. So, kind of along with the ADHD thing, I'm going to start talking about autism first. You might not see that too often, but it will come up once in a while, autism. One thing I want to say with autism is that everybody's so different. So one of my favorite quotes is, if you've met one person with autism, you've met one person with autism. So autism is a spectrum, and you got to remember that, right? So everybody is going to be somewhere else, somewhere different on a spectrum. So the severity is going to be different. There's going to be different characteristics that they have. One of the best things that you can do is to learn from your patient and your patient caregivers about that particular patient, because just because Joe over here has autism doesn't mean that Sue over here is going to act the exact same way that Joe did. So having that real good connection with caregivers and your patient is going to help you a lot. So with autism, some things you might see is poor eye contact, disinterest in what you're saying. They have trouble keeping attention. They may not be able to understand what you're saying. You may not be able to understand your body language or your nonverbals. They might have a flat monotone voice. Echolalia is something that you'll see quite often. So you might say something right now, in 10 minutes, they're going to repeat exactly what you just said. Other things you might see are behaviors like tics and stimming. So I know my fiance doesn't have autism, but even with his ADHD, he sometimes stims. So like stimming can be like rocking back and forth, just anything to it's keeping the body calm is what it's doing. It's regulating the body. So some people might get freaked out when they see something like that, but really it's nothing to worry about. They're just trying to keep their body regulated, and we all kind of do that in some way. Um, Other things that might happen is they might have inappropriate social interactions, so not knowing what to do in certain contexts, not being able to read those social cues in a room. So, like for example, if we're sitting in a classroom, they might not know that you have to stay seated like the whole entire time, and they might just all of a sudden get up and start running around the classroom because they're just not reading the room. They can't read the room like we all do, and then those unwritten rules of a classroom. Other things that you might see is a lack of empathy and trouble showing emotion, and being preoccupied with a certain topic. So I know that a lot this is very stereotypical. However, and as an example, we can talk about how someone might love trains and they'll talk about it forever and ever and ever, and that just really interests them. So that's one thing. They'll stick on a topic and they'll keep going with it. They might have trouble turn taking, and they might be overwhelmed by social situations. Now, if we move on here, this is something you might see more often, and that's apraxia. So what apraxia is, it's a motor or movement disorder. So what happens is the person with apraxia, they know what you're saying and they know what they want to say, but the connection from the brain to the mouth isn't working properly. So they have trouble speaking. And this is super frustrating to them, like so frustrating, because they know what they want to say up here, but it's not coming down here. So they can totally understand you and they know what they want to say, but it's just not working properly. You will see this with strokes, you'll see this with trauma, you'll see this with brain injury, like any kind of brain injury, infection, Alzheimer's, dementia, epilepsy, seizures. So it kind of comes with a lot of different disorders and pathologies that can cause this. My brother had apraxia as a child because it's very common in children, child apraxia speech. And let me tell you, it was so frustrating because he would be in tears, my mom would be in tears because he knew what he wanted to say and he couldn't say it. And my mom would know that he had something to say, but he couldn't say it. So it's really hard, and really like keep in mind people's mental health, how it's doing, because it might not be going so good. If we move along here to aphasia. So aphasia is when someone loses the ability to use or understand language. So again, this usually happens because of a stroke, and there's lots of different types of aphasia. We can take a look right here. We have Broca's aphasia, also called expressive aphasia. So the person can understand a lot of what's being said, but they have trouble speaking and writing. We have Wernicke's aphasia, and this can form they can form speech but have trouble understanding it. So sometimes they do make up words, they produce a lot of speech, but it just doesn't make sense. We also have global aphasia, where they can't speak or understand written or spoken language. And we have anamnomic aphasia, where someone has trouble naming specific objects. And again, the type of aphasia, it depends on what part of the brain was damaged. So whatever is damaged will affect different things, right? Okay, so hearing loss and hard of hearing. Also, we can talk about being deaf. So you might get a lot of patients with hearing problems. Of course, geriatrics makes sense, right? So again, this is mechanical or nervous. So there's an impairment of transmission of sound waves to the brain, causing a decrease in the ability to hear. Some signs and symptoms you might see with somebody that isn't able to hear properly is muffling of speech, difficulty understanding words, especially against background noise or in a crowd of people, trouble hearing consonants in words, frequently asking others to speak slowly, clearly, and loudly, needing to turn up the volume on television or radio. I know I see that with my grandparents sometimes. Withdrawal from conversation. So a lot of people, because they can't hear, so they will just withdraw from the whole entire conversation itself. I see that all the time in my grandfather. Um, and also avoidance in different social settings. So what you can do in these situations, there we go. And I would say this for everybody you talk to, all your patients, is to speak slowly, speak loudly, speak clearly, and use gestures. So, if you're going to be giving a needle, point to the needle, if they want a hairbrush, point to the hairbrush, that kind of a thing. Make eye contact, that's very big. And again, just like any other time, you want to be on their level and facing them. Another thing I want to point out too, and this is for patients that might not be responsive or anything at all. Please still try and talk to them and talk them through procedures, even though they're not. You think that they have no idea what's going on. They might still be able to hear you, so it's really good for you to talk to them. As we like to say in the speech community, as long as somebody has a pulse and is breathing, they can communicate in some way. Unfortunately for our patients, usually we don't have someone working with them full time to get them the kind of technology they need to communicate or to really investigate if they can communicate in some way. But it is good practice to sit there and talk to somebody even if they aren't conscious. So anyway, these tips and tricks work with everybody. Doesn't matter. You should use them all the time. I know on here I'm talking quickly, and sometimes I slur my words, but when I'm in the field, it's totally different. I try and always keep these things in mind, speaking loudly, slowly, clearly, and making gestures as well as eye contact and being on their level. I don't know how many of you want to work with peds or anything like that, but big important thing is always getting on their level. If that means crouching down, that's what you do. Even your patients right now, if they're in a wheelchair, it's easier to talk to them when you're crouching down beside them. Another really, really big thing for everybody is to pause and wait. Pause and wait. I can't emphasize that enough as well. There's you will be so shocked, so shocked of how much more information you're going to get from somebody when you just pause for a moment. We say between 5 and 10 seconds, and I know it can be hard, but pause and wait, because during that time, a lot of people are just processing things, and they just need all that time to process their ideas before they can actually say what they want to say. So if you can remember to pause and wait before carrying on a conversation, that's so great, so important. I would encourage everybody to do that. And this includes, you don't want to ever talk over somebody or just start talking before they have a chance to answer, because then you're not really doing them any good by just talking over them and answering for them. So just sit there and take a moment to wait and see what they have to say, because you might be surprised what comes out. I had that all the time with my kids that I was working with. people be like, oh, no, 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 they can't speak. They don't know what you're talking about. But yeah, that's one of the tricks that we are taught in school is to sit there and wait and let them speak. And there's so many times where when we took the 10 seconds to stop and wait, that these kids were actually saying stuff, and it's amazing. So same thing goes for any population. So just keep this up in your mind and try and use it in practice. Something else we can go like just touch on briefly, not like go over extensively, of course. Of course, people who are deaf, maybe even hard of hearing, uh, so basically they can't talk. Visuals is so key, so key. We love our visuals in speech and language. Just love, love, love them. So visuals are things that, of course, include your gestures, but it also includes sign language, so ASL, core boards we use with our kiddos, and I have a bunch of core boards that I made for you guys as well. They're just very simple core boards, but you can use them in your practice. So what core boards do is you can point to different things on the board in order to communicate with people. Sometimes you might have to start it off by showing them what you want on there in order for them to get trained to be like, oh, okay, so when I want something, I should point to it on here. So core boards, picture exchange communication systems. So kind of the same idea, using pictures for them giving you pictures to show what they want. A lot of people, well, not a lot of people, but people might come in with iPads and they can talk on their iPads and you can talk to them on their iPads. Super awesome. You might see letter charts on the wall, so kind of like what I have here on the PowerPoint, not quite the same way, but a lot of people, like some people might have these letter charts and they'll have a laser pointer and they'll be able to point to the different letters to spell out words to show you what they want. Other things that they've come up with is like eye gaze devices, so just like these technologies where they just use their eyes and they just look on the screen, and when they look at different places, it'll recognize their eyes there and it'll say what they want, like different letters or pictures might be in those corners, and they're able to look up and be like, oh, shower, just from looking in the corner, and the machine will speak out to you so you and them can understand each other. It's pretty neat. So keep an eye out for these things because some of your patients might have them, and it's super cool. And I encourage you to learn a little bit of sign language because it's really awesome. I even put a link at the end of my PowerPoint for that. Yeah, so let's move on here and take a look at your core boards. So mine didn't print out very well right here. I have another one, but it's in my clinical bag. And so with the core boards I made, it has some very basic things, like it has different numbers and months and feelings on the back. I have a pain scale, which is super helpful, super helpful, especially with kids. They can take a look at it and they can point to the different smiley faces depending on how they're feeling and be able to rate their pain that way, or their feelings, of course. And what I like to do with it is take one of those plastic sheet covers, I guess. You can buy them for like $1 at the dollar store for a huge pack. And then just put your board inside of here. So then you can easily just wipe it off between patients. It also makes it super easy if you want to take like a marker or something like that and take a marker and write on it if you need to write on it or help them write on it, or yeah, so that's something. And I also made a bunch of these basic pictures as well. So these are just kind of quick little kind of picture communication system you can use. Same goes for it. You can put it in the plastic cover, or if you really wanted to, you could use it. You could cut it out and cut out like the little individual parts, just like that, like in little squares. Try and laminate it or use tape, and you can put it on one of those little like circle keychain thing, so you can just easily flip through it with your patient and have them show you what they want, or have you show them what you're talking about. And that's a really great idea. Another thing that'd be really great with these is if your patient speaks another language, you can try and learn some words in their language, and you can label the different pictures with those words in their language so that they know what you're saying, and you know what they're saying. So that's pretty cool. We usually do that with our kids with English as well. I just don't have it on here because I want to keep it blank for you guys to fill in case you needed it for someone with a language barrier. So right here we have Dr. House. I just thought it was funny coming from this speech and language background, because it's very true. You know, when someone says something inappropriate but it's a complete sentence, like always thumbs up, you know, always encouragements. That's awesome. Yeah, I'll just move on, I guess. So yeah, right here I have some of the additional resources. So if you want to learn some basic sign, I highly, highly recommend you check out ASL That. It's on YouTube. It's totally free. He's great. When I was doing my sign language course, this is a resource that I would frequently refer to all the time, and it had just anything you could possibly imagine that you would want on there. So I highly recommend checking out his medical and hospital terms on there. And you know, you can learn to sign your name, say hi, tell them like that you're a nurse, you know, like that kind of thing. Yeah, it would be really great. Like people who are deaf or have hearing impairment that speak sign would be like so thrilled, because they love talking to people. It's amazing. That community is so amazing. Any other thing, like I have other things here. I have just kind of like the professional publications and general tips and tricks for kids with speech and language impairments. And remember, you can always, always, always talk to the speech and language pathologist that's there, any assistants or behavior specialists, or even OTs and PTs. From working in a team with all these therapists, I found that they're all just so, like, I shouldn't say all, but most people are so welcoming, and they're just ready to help, and they have an immense amount of knowledge and experience, and very creative people, and they're phenomenal to work with. So if you can ever sit there and chat with one about one of your patients, I would highly recommend it, because more than likely they'll be super excited to help you out. So again, here at the end, I just have my additional references for where I got everything. Most things are from my schooling at MacEwan University. Yeah, so I really hope that you learned something from my little presentation here. If you have any questions for me at all, like don't be afraid to like stop me in the hallway or something like that and let me know. I'm always excited to help someone out. Thanks for watching, and I know I put this on YouTube, so I have some other like weird videos on here. So if you want to like keep me as like a professional in your head, just don't check out those videos. I mean, if you want to laugh, go ahead, check them out. I make them for my family. Slightly embarrassing, but up to you, I suppose. If you need a study break and you want to make fun of Natasha, okay, go ahead, I guess. But anyway, I hope you all have a great day and you learned something today that you can take away with you and use in your practice. Yeah, so have a great day. Bye.